I would say almost equal, like 50% of our patients who walk in through the door, they have been trying to exercise, they put in the effort, but they don't see the results because the hormonal imbalance is making sure that they do not have the motivation to go and work out
Hmm.
or do the extra thing for the family or at work. And the other 50% just wants to get the medicine so they look and feel good on social media.
All right. I'm Nathan with Brotherhood Beyond Business. I'm here with Arabinda Subudhi with Gameday Men's Health. And I just want to learn a bit about you today. So if you wouldn't
Absolutely.
mind, tell us who you are.
Thank you for having me, Nathan.
Of course.
So my name is Binda. My actual name is actually Arabinda, but everybody calls me Binda because I found that it's easier for people to pronounce and remember.
Mhm.
So I'm the owner of Game Day Men's Health Clinic. We are a specialty healthcare clinic that focuses on men's health, and we deal with the issues that the traditional medicine ignores most of the
Mhm.
time. But what we found is when we treat, let's say, hormones or the root cause behind sexual health problems, it actually does amazing for a man's mental health. So that was the idea behind why we started Game Day Men's Health. And the name suggests that it's a clinic specifically focusing on men's health, so which is a safe space for men. We're a clinic located in Advocate Condell Medical Center in Libertyville.
Okay. What made you want to get into men's health? Was it someone in your family, you yourself, that experienced something with the normal healthcare industry? What happened there to kind of promote this or spice things up and get you moving in the right
That's a
direction?
great question. So I'm sure some of the other people who are listening, they would relate. So I was in the corporate world. I have an MBA in finance. I worked with many, many pharmaceutical companies, enhancing their business processes, helping them adopt software, artificial intelligence, data, and all of that. After 22 years in the field of software, I started getting depressed. My depression, it was a journey of 7 years of feeling low and even more low and lack of energy and all of that. And when I brought in these symptoms to my primary care physician, he was very dismissive of it. He just said, "You work too much. It's probably your eyes." And that happened for 5 years. Then I heard about hormone optimization and testosterone therapy on radio through a competitor clinic of ours. So I actually went there and find that my testosterone is in fact on the lower side. I brought back the results. But by that time, it's been 5 years already, and I was already deep in depression. I lost 15 pounds. I had fibromyalgia. So I was put on depression medication, and the medications are as such that you start out at a lower dose and then you increase the dose because they stop working at a lower dose and you go higher and higher. At that point, I decided to go against my primary care physician's advice and actually get started on testosterone therapy. Once I did that, it was a life-changing experience for me.
Wow.
The way I felt, it was probably took me back 20 years. My wife was happy, my kids were happy because I could play with them, right? So I strongly believed in the therapy. And then I made a decision to start looking into probably maybe getting associated with a business that does something like this. And the opportunity of Game Day Men's Health came up in the Libertyville area.
Okay. Is Game Day Men's Health part of like a franchise that you bought into? Okay. Talk to me
Yes.
about that process and how that
Yeah,
worked.
absolutely. So Game Day Men's Health started in 2018 and it was one clinic in California. They became extremely successful. Then they opened 3 clinics. It was still a family-owned business, but Dr. Evan Miller, who started Game Day, he saw a potential of expanding this care across the nation. So he then decided to franchise just 2 years ago, actually, in 2024. And after that, believe it or not, we have become the fastest grown franchise in the world ever. So that says something about the business, but also about the epidemic. I call it an epidemic of hormonal imbalance and depression that's plaguing the men in our society. There's a lot of things that's going on. So, yeah. And I wanted to get involved. I had to, of course, interview for the process with Dr. Miller multiple times because I did not have any prior business experience. So I had to win his trust over a 6 to 9 month period. And then they did see the passion that I bring into the business and then said, okay, fine, here is your opportunity to own a business, but we will handhold you and see how you do. And we are now the #1 clinic in the whole of Lake County. So that speaks something about our.
Oh yeah, I mean, I can feel the passion of your business. I mean, the fact that you went through it personally is huge.
Yeah.
Do you get a chance to share that a lot with like potential
Yes.
clients? Talk to them
Yes.
about how you went through the same thing.
Yes, we see a lot of young men now, unfortunately, in their late 20s, early 30s, experiencing the same thing that I experienced in my late 30s and early 40s. And many times that happens because of lifestyle choices, either by choice or by societal pressure. For example, excessive cell phone uses. I say that a lot because that's one of the primary reasons of why men feel this way. So they are depressed on ADHD medication and things like that. So we go through what changes can they make in their lifestyle and how can hormone optimization truly help them if they're really at that point that they need the care.
Okay. So you mentioned you thought it was like an epidemic. It's an epidemic of hormonal imbalances among men, mostly, I'm assuming, right? And you said you contribute that to behavior, at like behavioral choices, right? Most of those being cell phone uses. Is there any other major things you're seeing contribute to potential hormone imbalance from men? Because you said even younger men are experiencing hormonal imbalance. So what is it? Just do you think it's mostly cell phone? Do you think it's now we transition to sitting behind a desk all day as well? What do you feel like is they're not exercise? Maybe they drink alcohol. What do you feel like are the main behavior choices that lead down this path?
Great question in finding the root source of why this is happening. What we have seen across the 600 Gameday clinics by exchanging notes between the doctors is the single most important factor for quality of life impact and hormonal imbalance is bad sleep. The one thing, if you ask me, the one thing that would improve a lot naturally is good quality sleep. And there is a lot that goes behind why a person is not able to sleep, especially a man. The reasons range from something like divorce or multiple relationships, like the breakups and relationship. The relationships are no longer as steady as they used to be. That plays a big role. And of course, the social media pressure that's there. But the other regions that are kind of, we consider easy to manage, but there is lack of knowledge is microplastics, too much coffee, too much caffeinated drinks, sedentary lifestyle. So these are things we consider if somebody has a strong willpower or the right guidance, they can easily take care of themselves and get rid of the bad things. So these are all the reasons that help create imbalance between dopamine and serotonin. One is a pleasure hormone, one is a happiness hormone. And when you have imbalance in some of these hormones, they impact your sleep. When the sleep is impacted, then you produce less testosterone, less growth hormone. And when your testosterone and growth hormone are low, you can't sleep well. So it becomes a vicious cycle, like a recession in the economy.
I mean, you sound extremely knowledgeable about this. You said you've been in business for 2 years.
2 years.
Right?
Yeah.
When did you start studying all this? Before you even thought about Gameday? Or like when you started Gameday, you just started diving into this, studies after studies after studies? Because it surprises me the sedentary lifestyle thing is still so popular. Right? Because everybody knows they need to exercise, but they're not. Do you think you have, if you were to guess like a certain percentage of your male population that actually exercises when they walk into your facility, or do you feel like it's almost non-existent?
No, there is a certain percentage.
So-
We get, I would say, almost equal, like 50% of our patients who walk in through the door, they have been trying to exercise. They put in the effort, but they don't see the results because the hormonal imbalance is making sure that they do not have the motivation to go and work out or do the extra thing for the family or at work. And the other 50% just wants to get the medicine so they look and feel good on social media. Yeah, it's definitely, and 50% is a big number. If you go a few years back, I know men were like work, family, right? They wanted to do the right thing and do the right way. Like, okay, I'm going to hard work and I'm there for the family. But now it's how do I look good without maybe putting the effort that I am, truly supposed to put. So people come in like, hey, I follow this influencer and the person looks good. And he said that peptide or that particular medication made me look like this and I want to get on that and be like this in 2 months or 3 months. Or when they start on testosterone therapy, can you give me a higher dose? Like, I want to be 200 or milligram or above, which is a very high dose when it comes to testosterone. But they want to be there because they want to feel good. But they think that being high on medication will actually make them feel and look good without putting in the work, which is unfortunate, to say the least.
Not putting any habits in place,
Yeah.
and then they stop the therapy.
I have I believe like social media and our short-term memory has a role to play. We start very young with kids getting cell phones
Mm.
at a very young age, and all they see is the outcome, which is I want to look like this, I want to go there. They do not get to see the effort that somebody has put in to actually be successful, and it's not advertised, right? There is no true money to be made in the effort, but actually in the outcome, right? And people stick to, oh, I want to look like this. I follow him and I'll just do this, whatever he's saying, rather than what the person is actually doing. And it's a societal, I mean, we as parents have to guide our children also to do the right things.
So it's like, instead of seeing the 5 work of effort that went behind, all they see is the
Yeah,
finished product, and they're like,
that's it.
I want to look like a finished product
Yeah.
from a pill or a shot. And
Absolutely.
they're like, well, they may have taken a pill or a shot, but they did it with 5 years of effort, maybe in like the
Yeah.
minimal work or
They
whatever
may
it's like.
have, they may have hired a personal trainer or a
Mhm.
nutritionist to get to where they are, but they don't talk about it, right? They don't
Mhm.
talk about the journey. They talk about, oh yeah, I took this medication for 6 months. Look at me now. So unfortunately, there is also money to be made by selling whatever products they are trying to sell. So it's a culmination of capitalism
Yeah.
and it's a culmination of social media and easy access to misinformation. All of that combined is how we operate nowadays, I guess.
So it doesn't sound like the young man that's been influenced by a social media influencer is your ideal client, not necessarily, but like, who would you say, like, man, this type of person walks in my door, I get super excited to help them. Who is that?
So we get excited about anybody who
Mhm.
walks in. If somebody looks at our Google reviews, they'll find we are the number one in terms of people leaving us reviews after they leave us. We don't even sometimes ask for it. The reason that is most people that walk into our door, they do not actually sign up on anything because they feel like they learned so much more. They can try and do those positive changes in their life and health outside of medication. And we take pride in that.
Mm.
We don't force anyone to get started on medication if they don't absolutely truly need it. So the answer to your question is we love everybody who walks through the door because we think of it as an opportunity to educate them. But who is our ideal patient who must actually start on the therapy or who we would like to start on the therapy is a middle-aged man. Let's say we call it midlife crisis, right? So
Yeah.
there is a word called midlife crisis. Most men and women at some age, they go through that. Earlier, it was considered it's just age. I'm losing my spark. But many times, what happens is it's the stress in our life and the lack of sleep in our health and sleep in our life that's causing all these issues. And they think that, oh, it's just age. And we would like to help them truly experience what it means to optimize their hormone and feel amazing. Being 20 years again, 30
Feeling like
years again.
Superman
Feel
again,
like a
right?
Superman again. Absolutely.
So like, they feel like to have the midlife crisis, they just could be doing a lot of the wrong habits,
Habits, which
and their
is causing the
testosterone is
hormonal
plummet.
imbalance.
Yeah, the testosterone to plummet.
Yeah.
Wow. Okay. So then you mentioned a few things that obviously will set you apart about most businesses. Like maybe an average CRT place wants to just be like, you walk in the door, boom, here's your medicines. Like, let's get you started. You're like, no, not every person does that with us. Some people will leave just with an education and hopefully a habit-based program that will help fix them. So like, what else sets you apart from those other TRT places? What are your main differentiators?
Absolutely. So let me talk about a few things. 60 to 70% of the people who walk in through our door, we tell them that this may not be the right thing for them. Either maybe they are too young or they could try other options before they try something with us because we want them to get a long-term result. So that's the statistics behind it. We have seen thousands of people, but we only have probably between 300 and 400 patients, right? So the math speaks for itself and we take pride in that. The other thing is when somebody walks in, we do a free blood work to check their hormone level, check their hemoglobin levels, and check their prostate. Why do we do that? Because many times an enlarged prostate may give a man ED symptoms, which is nothing to do with the testosterone or lack of it. So we want to make sure that the prostate is healthy actually. And if it is not, guess what? You can go to a urologist, figure out if it's a prostate cancer or it's a benign prostate, fix it, see if that works. If it still doesn't help fix your problem, then we are there for you. We do that and we do that for free. I have probably 25 different patients from my church. Mind it, I'm not a Christian, but I do go to a church and there's like people who are like 70 years old They come to my clinic because it's so easy for them to get their prostate checked with us rather than going to their urologist and waiting for months and then fearing about, is my prostate healthy? We help them right away in 20 minutes. We also look at hemoglobin levels. And again, that's a free of cost blood work. The reason we look at hemoglobin levels is if your hemoglobin production is low, that means your body is not producing as much red blood cell. Of course, you'll not have the energy. That will give you all the symptoms of low testosterone. So we want to make sure that we can pinpoint the root cause to hormones and nothing else. If there is anything wrong, you better fix that. Then see if you are still experiencing the issues, and we are here to help. So that is the number one differentiator across all Gameday clinics. The other major differentiator is we do not have commissioned staff or employees in our clinic. They don't get commissions. They do get some bonuses, but no commissions. The general manager, which is in my clinic, it's myself. In most of the Gameday clinics, it's usually owner who works as a general manager. That's the motto behind the Gameday clinics, because we want to build relationships, but not try to push unnecessary medication like many other clinics do. I'll give an example. Most TRT places that you walk in, they would say, along with testosterone, you need to do this peptide, you need to include vitamin. Our point is, why do you need a vitamin B12 or B complex if you're not deficient with it, right? Why do you need an estrogen blocker? Why do you need a very high level of testosterone? Most of the online clinics, they lure people with advertised low prices, but they start everybody on the same dose and an estrogen blocker. And I'm getting into technicality, but we see a lot of people who go to online clinics and eventually 5 months or 6 months down the line, they come see us because their hormones level have been messed up because of a bunch of medications. And then it takes between 3 and 6 months to fix them. So these are the basic differences between any Gameday clinic and other clinics. We don't push free blood work initially, so you get to know your root cause and you do only what is absolutely necessary, and we will tell you if some medication is not right for you. Then leave you with education.
Okay, awesome. So would you say you do most of the education then?
Yeah,
Then
absolutely.
you hired a doctor or?
So yeah, our clinic is owned by a doctor who has set the processes and protocols and all of that, and all the staff in the, they're all medically licensed except myself, because I'm the business owner, but I'm not the clinic owner. That's the difference, right? So the MD owns the clinic, and all the clinical staff, like the medical assistant, the nurse, and the nurse practitioner, they report to the MD. And we try to keep the business aspect kind of separate from the medical aspect. For example, if somebody comes in or you come in and say, hey, should I be doing this? I would probably refer you, or definitely refer you to the person or the team who is medically licensed, right, for a medication dispensing and prescription standpoint. I will not be giving you the prescription, right? But I handle the business. Like, should I order a refill for you? What's the payment? And when should we do the blood draw? So I handle the administrative task, maintain the relationship, but the medical, the clinical staff is who handles the medicine and all of that.
Okay. So you said like the MD owns the clinic, right? How does that person get then with you? How do you create that team between you and them?
Think of it like a partnership.
Okay.
Between an MD and somebody like me who is not an MD. So that person, or our MD, Dr. Kang, he controls the entire protocol. Like, how do we run the labs? When do we certify the labs? When do we prescribe a certain medication? When do we not prescribe a certain medication? What happens if the blood pressure goes up? Right? So those are all the protocols that you need medically licensed individuals. So he decides all of that, and all our staff follows it, right, to the letter. And then
Gameday partner you with him? Gameday found him. Gameday found him and you and put you together. Okay,
Absolutely.
okay, I get it now.
Yes. Gameday does for all the Gameday clinics, they find an MD for a particular location and they partner them with us. Okay. Because they need to make sure that the person is right also.
Right. So, and they're also passionate about what Gameday stands for. Right.
Yeah. Our MD is amazing. He's 42 years old, my age and our age, and he does adventure sports all the time. If you look at him, he's jacked. He's not on testosterone himself yet. But he has a long history of knowledge of pain management, surgeries, and hormones. So we feel like we're in good hands.
Cool. So all right. So I feel like I have a better understanding of how that side of things work. Okay, very cool. What do people misunderstand a lot? What do you feel like people always get confused, or they come in with a certain way of looking at a business like
Yes.
yours.
Yes.
What do you think is that number one thing people get?
The number one thing is the misinformation or the fear of testosterone therapy or clinics like ours.
Mm.
And there is a strong reason behind it. The fear is not unfounded. For a long time, our clinic or our practice, like the testosterone therapy in general, was not officially a therapy, so as to speak. It was provided underground, it was provided in black market. Many times people used it for the wrong reasons, which is to build better muscles or be sexually more active, right? So what happened was, when it was happening for so long, when it happened for years in a wrong way, people never really checked their levels to make sure that they are doing it the right way or their levels are fine. And usually in the long term, they ended up damaging their certain things, like for example, either testosterone being too high or having a cardiac arrest and all of that, which is a possibility when you are on very high level of testosterone therapy. So that is the reason we do it the right way. But because of the stigma that is associated with testosterone therapy, people come in with a same mindset that, I don't think this therapy is right for me, but I'm just here to find out. Well, once they speak with us, they realize that, okay, this is a difference. This is a completely different type of therapy. The reason for why that happened is our business or our therapy did not have the pharmaceutical backing. The reason being, it's not a branded medication, it's a generic bioidentical hormone, and there was no pharmaceutical backing. That means there was no investment in studies and doing it the right way. And pharmaceutical companies and insurance companies made it very hard for people to get it the right way. When you make access difficult, there will be a black market. When there is black market, there will be side effects. Unfortunately, we are dealing with the reality of that. But I'm glad that social media and information online is helping people do the right thing nowadays.
For sure. So you mentioned, gosh, I lost my train of thought. But I was going to say like,
Pharmaceutical.
oh, I can't remember. This is a So, for example, like when I remember now, when someone comes in and they're afraid, right?
Yeah.
You probably have someone who's got that fear side of things, like,
Yeah.
oh my gosh, this makes me nervous.
Yeah.
You probably have the next person who walks in and they're like, well, you have two, maybe you have to like, just help me,
Yeah.
right?
Yeah,
So,
absolutely.
how much is it the fear side of things you have to overcome versus how much is it, man, this person just needs help? Is it 50-50, or is it like there's a lot more people I have to educate to
Yeah.
deal with the fear?
Yeah.
Is it that side?
It's I would say 75 to 25.
Really?
Yes, a lot
Okay.
of people are afraid. A lot of people have had or heard about bad experiences with online clinics. So unfortunately, now the other side, everybody knows somebody who is on testosterone therapy,
Of course.
and everybody knows somebody who has done it the wrong way and experienced the negative side effects, especially either with online companies or maybe a urologist or somebody who didn't have the right experience to handle the testosterone therapy the right way. So now people come in with fear, but the fear is two-sided. I don't know if it's right, and I've heard things on Reddit and things like that, bad things, but I also get people who are like, my friend takes it and he had this issue, he had this side effect. Testosterone therapy worked out well initially, but then he got ED symptoms and a lot of acne and all of that. How do I deal with it? So it's a lot of education and talking. And we start out by saying that, hey, we don't even know if this is right for you. Let's do a free evaluation. Let's look at your symptoms, look at your age and your life goals. And if this is right for you, based on the blood test and your symptoms, then we'll talk about the options. You leave your credit card at home. We say that loud and clear. You leave your credit card at home so that you can come with an open mind and listen to what you have to say. And then you decide if this is right for you. And most often than not, they usually come back and sign when it's right for them.
So you would say when the average man comes into you, they're not actually signing up that day. The average
So,
male signs up later.
Yeah, specifically in our clinic, we have completely made it a no pressure environment in a way that they feel comfortable even living. Sometimes what happens is they go out, talk to their friend, talk to the wife, and come back in a few days to few months. The folks who usually come back in few months is we found is they kind of try to shop around, right? They get the education from us, and then they try to have the same conversation with other clinics in the area. I'm proud to say that not a single person who went out ever really signed up with somebody else locally. Some young guys may have signed up online for cheaper prices. They come back much later. But the guys who are middle aged, they always come back to us because they never have the same type of experience and conversation with any other provider. And they never have. And we are very competitively priced. So nobody can match our price too. So they usually come back to us.
Very cool. I love the fact that you're always so willing just to help these men out so much.
Yeah.
Like, especially the ones that like come in, they have so much fear that you have to overcome. That's tough to do. But it's so cool probably when you're having those conversations, and you probably know each moment, when each conversation, when you see the fear just like slip away, right? And you're like, they know now, right? You mentioned like obviously social media, like things are, would you say they're more trendy now than they've ever been for testosterone? Or do you feel like it was started maybe a few years ago?
Yeah, it started a few years ago. It's definitely not that much of a taboo nowadays, but that's also causing a other problem of not doing it the right way. Right? If a bodybuilder is on a high dose of testosterone therapy for a short while for a competition or something, that's very different from a middle-aged man or an older man being on a high dose of therapy in a long term. It could cause a lot more side effects. So people look at they like to follow personalities, right, on social media and try to follow everything to the letter, but they forget that everybody's built different, their activities are different, their genetics is different. What we can put in is the 100% effort, like going to the gym, watching your diet. But the medication is something should be adjusted based on their own lifestyle and genetics, not necessarily who they follow up with.
Yeah. So it's more trending than it's ever been.
Yeah.
But it's also more maybe more abused than it's ever been as well. So it's a good thing Gameday is there to help fix that problem.
Not for everybody, though. Unfortunately, a lot of the young guys who follow these personalities, like when I say young, I've seen 17-year-olds being on this controlled substance without telling their parents, to all the guys who are in their 20s. And they go to the gym and they see the next guy who is bigger than them and is on TRT, and they get the medication in the black. They come and see us when they're having issues like heart palpitations, or they can't sleep, or they're having severe ED issues. Only then they come see us. I wish they had come seen us like much before, so we can advise them against it. But we can only do this much, and that's why I guess you and I are talking today to maybe educate some more people.
It's being reactive is so much harder. I mean, fixing things is so much harder. It takes so much longer than doing it right the right way.
Very well said. The online clinics nowadays, there is just so many. What they do is they start everybody. It doesn't matter what your background, if you had cancer, if you have a kidney function, anybody can get on any medication nowadays, right? So they start everybody on a very high dose of testosterone. They start everybody on estrogen blockers. Estrogen blockers are required when excess testosterone in the body converts over to estrogen and causes all kinds of issues like bloating, mood swings, ED problems, because it's the female hormone. Women need estrogen much more. Men need estrogen very little. But if you are on very high testosterone, you'll have more estrogen. Estrogen blockers are extremely powerful medications. One person should not be on it for more than like 8 to 10 weeks. But we see a lot of patients who are on it on a long-term basis because the online clinic said so. And the reason they do that is they do not want to actively manage your therapy. They want everybody to be high on testosterone so that they feel good, but they also want everybody to be on estrogen blocker so that they do not have to worry about your estrogenic effects and symptoms. But in the long run, it's actually a negative for your longevity to be on estrogen blocker. Unfortunately, we see that a lot. The second problem that we see is hemoglobin being too high. When somebody is on testosterone therapy, their blood will thicken too much. But when they are with online clinics, there is no proactive treatment to measure if you are feeling good. Then, oh yeah, your next blood draw is 3 months to 6 months down the line. We will check it then. You don't want to carry very high or thick blood with you for 3 months. It could cause cardiac issues. So that's where we come in to do it the right way. I know it sounds scary, but it's better for people to know what could be the negative side effects versus not knowing and doing the wrong things. It's much more expensive to do the wrong things.
Right. It's really important to get that information out there, right? They need to know the right way because having the knowledge is extremely important. Then hopefully they apply it by going to like something like this, not going to like a online clinic or something like that. So Yeah, I like all this stuff you say about like how game day and like obviously the way you go about it is so much different. What would you hope though people say about you? You know, they come in, they meet you, right?
Mhm.
Every single person that walks through the door meets Binda. What do you hope people will say about you when they're all done?
I think they always say that they learned something really, really valuable information. And our goal is for people to kind of know more when they leave versus when they came in, right?
Hmm.
We try to exclude all or remove all the misinformation. But not just that, we also try them to be holistically good. And I guess that's where businesses like yours come in handy because we want people to feel and do the right things outside of our clinic. And that's where a nutritionist, somebody who has knowledge about human body, right, the right exercise techniques, and all of that comes in handy. So yes, people say good things about us. They always say good things about us. There's not a single bad review, but I wish more people did the right things or implemented what we told them or spoken to some of our partners. So one thing that we do differently at our game day Libertyville clinic is partner with local businesses like yours so that they can holistically feel good. It could be a fitness center, it could be a nutrition, it could be a food prep, right? Like
Hmm.
doing the right food prep because everybody needs the right advice. It's you can never go wrong with the right advice. That's what we feel. And we do not have, like, our clinic does not have all the ability or the knowledge to help guide the men in terms of nutrition and diet and all of that. And that's why we try to compensate that by forming partnership with businesses like yours to help them feel good holistically.
Okay. So, like, we want people to leave your business knowing that Binda gives the right
Right.
advice.
Advice.
That's very,
Yes.
very cool.
Yeah.
So, if you were to like step away from your business, right, what would you hope still existed? Let's say you weren't the GM, you weren't doing consultations and stuff
Mhm.
anymore. Is that what you would say? Like, you'd want to continue, like, you'd still want that personal touch to stay if you had to like step
Step away.
away?
Right.
Yeah.
Yeah. So I take pride in the fact that we have built a very good team. And I think you have met some of our staff members
Hmm.
as well. The way they are trained and experienced is no pushing, only listening, and then educating. So everybody in the team does a good thing. So if I was to step away, I still feel very, very comfortable that the business is going to run in itself.
Hmm.
But it's just that there'll be more workload on the existing team
Hmm.
members, right? And it will take the medical staff away from some of these conversations that I can have. For example, setting up an appointment, gathering some details, and all of that. So I still, yeah, that's a good thought. I still want the business to run,
Hmm.
but this is what I'll say. When I went through my experience with depression and excessive weight loss and all of that, and fibromyalgia with multiple joints hurting, I made a decision that since this therapy helped me, I wanted to help the men in our community. Since it's a franchisee, I cannot go outside of the territory of the franchisee. You know, that's how the
Hmm.
businesses work. But anybody who walks in, anybody we interact with, I really want to help them with knowledge, with medication, short term or long term doesn't matter. We really want them to do the right thing. And we take pride and feel very happy that somebody was able to transform their life and health with our help.
That right there, every single person needs to hear, right?
Okay.
If they heard that come out of the way you just told me, I don't see how anyone would not completely trust and understand that, like,
Yeah.
what you want most out of them is the best thing for them,
For them.
even if it
Yeah.
means no medicine. That
No
is so
medicine.
cool to hear.
Yeah.
So, I mean, obviously, we talk about stepping away from business as business owners sometimes. Like, we hope it still runs, but like, we are passionate about the business, why we do it. So, how do you make sure that you balance business, like doing all the things that you want to do
Yeah.
with, you mentioned having kids, so you got kids and a wife. How do you do both? What do you find? What is hard? Is it harder than you thought it was going to be, or do you feel like,
So it's definitely harder than anyone thinks running a business is going to be. It's not that fancy dream. It's like you have to put in a lot of work. But opening up this business has actually given me more time to spend with the family because you must remember I was suffering from depression.
Mhm.
When I was doing that, I was working from home in a corporate world. But for 2 years, I was as if non-existent in the house. I was not able to do anything because I was severely depressed. So when I compare myself to that particular situation, it's a much better situation because I have the energy to be with my
Mhm.
kid. I have the energy to be with my wife, help her with the dishes or go on the weekends. Now, Timing is a different thing. So I do have the energy, but timing comes down to like, how do I run the business? So the way I have structured my timing with the clinic is there are 2 days in a week that I do not go to the clinic out of a weekday.
Mm-hmm.
So that's Mondays and Wednesdays. And we give Mondays holiday to, Mondays are off for everybody in the team.
Okay.
So that they get a little bit longer weekend and they feel fresh and they're itching to come back to the clinic. Because happy employees are the primary reason why your patients will be happy, right? So Mondays and Wednesdays are off. I stay at home, talk to people who have reached out, follow up with existing patients, and try to spend some time with the family. And weekends kind of do the same thing, but many times weekends I have events to attend to to promote our business. So it's the Mondays and the Wednesdays that compensate for the weekends not being.
Do you feel like it's almost like if you have to block off time to be with family, or does it like
No,
just kind of grab it?
initially that was the case, but now that we are more mature and the community knows us, it has we've kind of built a trust that it's become a little bit easier now in convincing people, right? And then everybody knows somebody who has gone to a game day clinic. And also the fact that there is 600 clinics of game day men's health across the country, and we are the number one in whole of North America in a very short span, like in 2 years, right? So that speaks for the way we do our clinic and business. So it has definitely made my life easier to run this business.
How many kids?
One.
One. And how old?
13.
13.
Yes.
Well, it's going to be a
Going to
tough
school.
age.
Yeah.
So,
It's nobody teaches us how to handle a teenager.
no, it's just like everyone's got a different teenager. What happened?
Oh, that nice smiling girl, and now what?
So yeah, that's. I mean, it can be really tough to like balance, obviously owning a business and then trying to be there as a husband, as a father, and then like the family man that you dream about.
Yeah.
But there's also a lot of tough decisions you have to make as a business owner for the business. How do you go about that process? Who do you lean on in those tough moments?
Absolutely. So far it's been my wife at home who has been a big supporter because, I still don't get a salary from the business. I'm still trying to establish the business. That means she's the breadwinner of the family. So I do consult with her, and my team has been with me since the beginning. All the team members are MD and everybody. So I take professional help from them. But I'd say this, any decision we make with the best interest of our patients. If we were to, let's say, prescribe a new medication, the only thing is it good for our patients in our community? If we find that in a certain area, there's a lot of people with high blood pressure, will not prescribe the medication, even if it's very profitable therapy for us. So there's a lot of peptides available in the market. We only prescribe very limited peptides, the ones, for example, that have a strong proven record of improving somebody's health. So we wouldn't prescribe any peptide willy-nilly and experiment with our patient's life. We could, but we will not. So that's the primary decision maker for any tough decision is it going to benefit our business, our patients, or not? For example, if I was to hire one more staff, I would think twice because adding one more staff comes with more expenses. And then I may have to increase some of the prices for our patients. Is there more value in having that staff and increasing the pricing for our patients? If not, I wouldn't hire. I would rather do 2 jobs at my same business. So every decision is based on our patients' value.
And then you mentioned not taking a salary yet, but like you've been in existence for about 2 years. Is there anything you think, so like I don't know if you get business coaching from Gameday? They do that? Okay. Yes. Like, is there anything that you're like, oh man, 2 years ago, if I'd have done this, we would be even faster than where we're at?
Exactly. Yeah. Right. Yeah. So there's probably spending a little bit more on social media marketing would have been better, but hey, you always learn on a daily basis, on a monthly basis. So yeah, spending a little bit more would have been better, but I also wanted to be careful that we are able to handle the large volume of patients that come in and we provide a good care to every single person. So because it's a balance, right? If you grow too fast and your quality of care suffers, then it's once you have a bad experience, we don't usually go back to the same place, right? So thankfully, nobody has had a bad experience at our clinic out of the 400 patients that we have. So that speaks volume. It's a fine balance. But yes, I sometimes think maybe I should have grown a little bit more aggressively to increase the revenue a little bit faster. We're human beings. We always have regrets. So.
Yeah, it's like you say though, like You are growing pretty good. You get 400 patients. Like, what would happen if you had 400 patients? Bam. Yeah, you're like, man, this because like I mean, you guys you do a good job getting good reviews, right? But the one thing people will always leave is a bad review, right? Right? And it's like you have to like work to get a good review. Feels like, right? You have to put effort into getting a good review. You have to do nothing to get a bad review. just do a poor service, and people will leave you a bad review.
Have a single, even a 4-star review, I guess. So it's all 5-star reviews. So let's speak something about it.
Oh, for sure. I mean, I love that part where you say like the number one thing is that you want to care either you want to make the best possible decision for that person, right, in that moment, so that they have the best advice, they can make the best decision for their health, right, for the long term, because you don't want to be a quick fix facility, because then they're going to be coming back to you. They're like, well, Gameday only cared about taking my money, and then like I'm back to where I was.
Exactly.
So that is phenomenal. I love that story about what Gameday is and like who you are and your passion and how you got into this with your own experience through having low testosterone. Do you still have yourself?
No, I'm on the therapy.
So
Thankfully, I do not have it. And that's what keeps me going. So
awesome. It gives that all that energy. So you are a testament to this thing. That is so cool. All right. Well, I just think you've been such a great story for people to hear out there. I hope every man in the local area will hear it and get a little more educated on what testosterone therapy is and what Gameday is for the local area. I'd say like Lake County for sure, like benefits from having you guys here. So that's so cool to see. With more and more people getting educated on TRT, I think more and more men will finally start to understand that, hey, this is what I actually need to do, right? To actually get back to my old self, to feel like Superman again, right? Because like they had all these bad habits, lowered their testosterone, fixed their habits, maybe a little bit of testosterone therapy, and before you know it, they're back to their old self.
Absolutely. Not just that, we do weight loss medications, we do peptide prescriptions, we do IV therapy. So there's a lot, or there's something for everybody, but it's the first step that you must take, which is the hardest, right? And then coming and speaking to somebody who knows what they're doing versus just relying on information that's by AI, because you must understand AI gets the information from sources which is not really medically validated. So something to keep in mind.
All right, man. Thank you so much for your story. I loved hearing it. I'm sure everyone else will.
Hit subscribe, turn on notifications, and stay locked in. Brotherhood is more than business. It's about leading from the front, leveling up in every domain, and becoming the CEO of your own life. Step up, execute, and we'll see you in the next one.